things have changed over the years I've been coming here. I've got a lot more trust in the doctors because of the way they treat me now than I did years ago. Dr. Eagle, he came in today. He talked to me like, it's unbelievable the way he talked to me. It was great. And he's telling me what's going to happen, and he made me feel better about everything. I've got something very serious wrong, but these doctors, they're going to take care of me.
So the whole notion of patient and family-centered care, I think, is the notion that we're in the care journey together. It's not we are caring for you, it's we, including you, are working together on trying to improve your health state. So what does that mean? First is, they're the center of the whole team. Now, they're on the team. The team starts with them. They have to fully embrace their participation. We have to find transparency with how we communicate and document their medical journey. They have to have access to that.
As soon as I show up at the bedside, the patient already has a story in their mind that they're ready to share. They already have questions, they've got fears.
When we include them and we explain to them why we're getting the tests that we're getting and what these tests are showing and how they're guiding our management, I think it empowers them, makes them feel like they're a part of their care, and I think it makes their entire day and their entire hospitalization run a lot more smooth.
I do believe that they do give a lot of consideration to questions and my concerns as well as my family's.
When you have family around, if I don't think of things, then she does. And then she brings it up. Because I think you have to have somebody out there to speak for you.
It seems to catch potential drop balls or errors. And I think it certainly increases the confidence that the patient and family has that there's a continuum of both care and communication around the care that is not missing things, and that is open to criticism or critique if somebody says, well, mom's not on that drug. That happens. You know, it's a complex world.
The families feel more comfortable, the patient feels more comfortable, they are given choices now, and who's going to take care of the patient when they get home but the family?
My preference is to go into the room, sit on the bed with the patient, introduce all of the members of the care team, what they do, and then say to the patient and the family, we're going to talk about your care now, and somebody's going to lead it, and I'm going to comment. And then at the end, we want to make sure that we are all on the same page with what your care plan is, that any questions or fears that you have been answered, and anything else that we can do to make your stay comfortable. When we do rounds, if the nurse isn't there with the care team, then the likelihood that communication will be seamless between what the physician side may want and what the nurses will implement through the orders may break down.
I love to round with the doctors.
The nurses treating you all right, or are they rough?
No, excellent.
His nursing care is excellent.
A lot of times rounds can be very intimidating, and sometimes the patients forget to ask questions. So sometimes I might chime in and say, hey, didn't you want to ask about that procedure? I try to keep my patient as informed as possible.
You may have seen we have a whiteboard that has a list of who the doctors are, who the nurse is, who the students are. And it has a kind of the daily care plan, what's going to happen today, and what are the goals for today. That's very helpful because sometimes we forget things, you know, rounds are going by and suddenly at 2 o'clock the patient's trying to remember what's happening to my care today. It's there. The other thing that's happening is the whole way the nursing shift change is occurring has evolved. The nurse who's been on the day shift is sitting with the patient and family with the new nurse who's taking over. And so there's this transparency. I was your nurse earlier today. This woman or man is going to be your nurse for the next 8 hours. And I'm going to discuss with them what we did today and what the plan is so that we're all on the same page.
Coming to U of M, I was a little skeptical because of it being a teaching hospital, that you have a doctor come in with an entourage, but I feel like everyone communicates. They communicate with my doctor, and they communicated with the doctor that did my procedure, and I just feel like anything that came about from my visit with Dr. Eagle today is going to be communicated to the other physicians.
Nowadays, medicine's really a team sport, and so there's not only attending, but the house officers like myself, but also the medical students and the pharmacy students, and so, we're all involved in the patient's care, so I think it's important that the patient, is introduced to all of these people that are taking care of them.
If they're here on it as a team and they feel that I'm not satisfied with what they told me, okay, what do you want repeated? What don't you understand?
The patient would prefer to be communicated to instead of just, having the care team communicate behind their back and then having this incomplete information in front of them.
We're making life or death decisions, and those kind of decisions, they require more than 2 to 3 minutes in the room.
There may be some insight that family has that I don't have on things that work for that patient, and if we can incorporate the physicians, the goals will become the same for everybody, and we have better patient outcomes.
Patient satisfaction scores have been a motivator for many people to incorporate these types of practices and principles. Additionally, literature is showing more and more our patients and families, when they are part of the care planning, we actually have better outcomes. We have reduced length of stays, we have reduced readmissions, we have less errors, and when you do all of these things, you are obviously affecting clinical outcome.
One of my very favorite quotes ever is Maya Angelou's. She said, "In my life, I've come to realize that people will forget what you said, and people will forget what you did, but they'll never forget how you made them feel." And that's where we have the opportunity to actually help all of our patients and our families heal in ways that may be beyond the actual healing outcome, but heal as human beings, right? It's putting the humanity back into healthcare.